Bismillahirrahmanirrahim. Our case today, common medical emergency. 3-month-old boy presented to ER with history of left eye painful swelling. Left eye painful swelling associated with fever and runny nose. On examination, left eye examination, there is tenderness and swelling, ecchymosis and proptosis with decreased eye movement and visual acuity. So what is the three cardinal sign to differentiate between orbital cellulitis and preorbital or preseptal cellulitis? The three cardinal signs for orbital cellulitis: proptosis, decreased eye movement, this is called ophthalmoplegia, and also decreased visual acuity. ENT examination, the ear and nose and throat. The nose congested and runny nose, but no otorrhea or rhinorrhea. Other systemic examination for the complications like cavernous sinus thrombosis, meningitis, no evidence of complications. And also you have to concentrate for eye examination to rule out dacrocystitis. This is the underlying cause for orbital cellulitis in neonate, and sinusitis. This is the underlying cause of orbital cellulitis in old child. So the impression, this is left eye or unilateral orbital cellulitis. Why orbital cellulitis? Because there is left eye painful suppurative swelling with ecchymosis and decreased visual acuity, decreased eye movement, and proptosis. So how to approach for orbital cellulitis after history, clinical examination, impression, evaluation? So you have to admit this patient. Why? Because this is medical emergency. Then you have to refer this patient to ophthalmologist to guide the management, and you have to refer also to ENT consultant, because the underlying cause for orbital cellulitis it will be sinusitis. Then you have to take lab workup and imaging study. Lab workup, septic workup, and imaging study like CT, orbit, and the brain to rule out what? With contrast, to rule out sinusitis and brain abscess. MRI brain, yes, if there is evidence of complication or cavernous sinus thrombosis or cavernous sinus thrombosis, because this is a complication. Cavernous sinus thrombosis, brain abscess, optic neuritis, meningitis. Then the treatment. It will be three parts. The first part, conservative or supportive or symptomatic treatment, medical treatment, surgical treatment. Conservative or symptomatic treatment, so you have to give what? You have to give analgesic and anti-inflammatory for the fever and the pain. And also you have to start nasal decongestant, because there is underlying what? Sinusitis. It will help. It will be under guide of ENT doctor. Then we'll go for systemic antibiotic. What antibiotic in orbital cellulitis? You have to use what? Third generation cephalosporin, cefotaxime or cefotrixone, 50 mg per kg, 6 hourly, and add fluoxacillin. It will be 50 mg per kg, 6 hourly, or what? Vancomycin if there is evidence of MRSA, methicillin resistance, Staph aureus, because the common organism it will be Staph aureus or streptobiogene or streptonomini or Haemophilus influenza. So it will have to conservative treatment, then medical treatment. Medical treatment it will be antibiotic. Third generation cephalosporin, cefotaxime or cefotrixone, 50 mg per kg, 6 hourly, and plus of fluoxacillin or fluoxacillin, 6 hourly, 50 mg per kg, and vancomycin you can add if there is evidence of MRSA or methicillin resistance Will continue for 14 days, or you have to start to 2 to 3 days. Then you can shift it to oral. It will be amoxicillin with glavulonic acid or augmented to complete 14 days if the patient is stable. So what is the indication for surgery? surgery. Indication for surgery if no response to medical treatment or there is evidence of complication, meningitis or brain abscess, so you have to go for surgical treatment. In summary, orbital cellulitis, this is deep skin infection due to Staph aureus or strep biogene. Patient will presented with unilateral eye painful suburative swelling, and if there is proptosis or ophthalmoplegia or decreased visual acuity, this indicates this patient orbital cellulitis, not preorbital cellulitis. And you have to look for dacryocystitis in unit because this is underlying cause, and sinusitis for all the child, and you have to look for the complication, meningitis, cavernous sinus thrombosis, and the brain abscess, and ophthalmoplegia or optic neuritis. شكرا، سلام عليكم.